to me really important. People resist change for different reasons. They have self-interest, it might not suit them, they might not, not work, they might misunderstand what's expected of them. People have a low tolerance of change. Certainty is really important for people. And then in this environment, people just might see things very differently. They might assess the situation quite differently. And one of the things that I found really useful to explain to people is that actually all change is a loss. And this is the Kubler-Ross change curve. This is the loss and grief cycle of grief and loss. It developed, look at when people were coping with grief, when people had died. But this change curve is quite useful. What we see is that first, people are surprised and shocked. It's like, I can't believe this has happened and I've got to work from home and I'm not seeing my team and I've lost my students. So what we see is they go through the different stages of the curve, and as leaders, what we need to do is work to help people through the change. So in the first one, where it's shock and denial, we need to create alignment. We need to put people together, working in teams, working on common purpose, working to achieve things. When people get frustrated, we need to maximize communication. And I can see this, feel this for myself, that I was trying to log on remotely and my computer at work crashed. And then I thought, oh no, what do I do? What do I do? I had to go into work, open the computer and all the rest of it. So it was quite frustrating at first. What we're also seeing is people getting low mood. And I think this does happen. Sparking motivation when you're working from home and you're away from your teams and you're away from your students and you're away from your normal working life is very difficult. Okay, and we do hear of students, I find it hard to get motivated, and I feel the same for my team. But then we can start to develop capacity and experiment. We're starting to actually, our morale and competency is starting to go up here. And then finally, we're starting to share the knowledge. Hopefully, this is where a lot of us are at the moment, learning how to work in the new situation, sharing good practice, being collaborative is all that sort of thing. And then hopefully at the top, where our morale and competence is going up. But people will cycle around this curve quite a lot. It's not, well, one way and you're out at the end. You can keep dipping down. And I think one thing that's useful to think of from an individual perspective is actually what is in your control. You can control yourself and your behavior, and your thoughts. But you can also influence people, and leaders as role models is really important. So the orange bit, influencing bit. And then some things are completely out of your control. I can't control how the government tells us to come out of lockdown at all, but I can influence how I feel about it, how my students do, and I can lead by role modeling. So the spheres of control.
Okay, I think there's the... Hi, Judy.
Yeah.
Yes, that's good. There's some delay in the transmission again. Okay.
Oh, my internet connection's unstable. Yes, I'll keep going, and if I disappear, you'll know what's happened. So the ending is important. People actually acknowledge what people have done, and then as we go through, we're here now. We're helping individuals change, listen, and sympathise. Education, training, and development, and then finally, when we have new beginnings. Which we haven't got yet really, but we can celebrate the successes that we've got. We might have graduated our students, or whatever it is. We've just graduated our first final years early, and they're now working in the NHS, so that was a good celebration for us. So we also have to think about cultural aspects of change. I know Ardy's going to pick this up, and this is where inclusive leadership is needed. And we have to think about, if we look at the top of this cultural web, this is where we think about what are the stories we're telling one another, what are the stories we'll tell each other about what happened in the pandemic, what rituals and routines can we set in place, So it's really thinking about keeping that leadership story going, even when we're all scattered around the place. And Ardi will pick this up a little bit, but this is the dimensions of culture. What we see in these 6 aspects here is that countries and cultures are very different in the way they respond. And I know Ardi's going to pick up uncertainty avoidance and feminine and masculine. And this is something you can actually have a look at, like, really interesting to see how cultures are different and how different countries are different. And there's a lot of research on this, and we have to think about how people work. So my penultimate tip is it's really complex. Everything is not straightforward. Some things we can manage straightforward, but we need to think about this systems thinking approach, because educations are very political. They've got tribes and territories, but also this challenge gives us an opportunity for change and innovation. And this diagram by Ralph Stacey, just to show you this, really thinks about how we work. When we've got high agreement about what we should do and a certainty about everything, we're working in the simple zone. As our agreement or our uncertainty gets lower, then we start to move into the different zones. And what we do in leadership is try to work in this zone of complexity. And because that affects change. What we don't want to do is have chaos. So for us leadership perspective, what we can provide sometimes is that degree of certainty about what we will do now, even though there might be uncertainty outside. So to put the poll question up for me, Nadia. Can we put the poll question up? Ah, thank you. So just have a think about this. Which zone do you feel you're working in right now? Is it chaotic? Is it, no, we don't know who you are, so you can say if he feels chaotic. Is it complex? Is it complicated? Or do you feel you're actually working in a simple zone? Okay, I think we'll end the poll. So lots of, okay, it's quite good, excellent. There we go. Quite good that we're not in too much in chaotic. I think that's quite useful. But a lot of us feel like we're working in complexity, and we need to, in some ways, be comfortable with that as leaders. But what we need to do is pull it down to that simple zone, so we're working in a space that we can actually manage. Okay, so let's go back again. Okay, so why is my screen not working? Oh, yes. So finally, just to bring it to a close, this idea of what we call meta leadership by Stadelman is really interesting. And what he talks about is you as a person and the connectivity that we need to do managing in a situation. And I think it's a really useful way of thinking about this. And again, this is something that you can look up, but it's balancing how you are and how you manage yourself, how you manage your connections with people, but also how you work with that situation. And these are just some of the tools that you might want to think about to do that. And then the final one is celebrate all the successes that you can have. And actually, it is a new reality at the moment. We're working in a really different times, a time that none of us have ever worked in before. So let's celebrate what we do well, and let's accept the fact that things are different and they'll probably never be the same again. So change is the only constant then, but this is a change like no other. And I think for leaders, we need to frame this crisis and change in positive ways, but let's be honest about what's possible and what's not. Communicate clearly and regularly. That's what people want. And that's what I'm trying to do with my students, definitely in my team. If you're thinking about change models, those linear ones are useful, but in practice. Okay, thank you. That is me.
Okay, thank you very much, Judy. I think in terms of providing very sound theories on leadership and change management, you're the best, as always. The speaker after this, we're going to hear the reflections from the female leaders from Gadjah Mada University and also from Universitas Indonesia. So I have to be honest that this is not part of the plan that today we have all female speakers. It was not originally the plan. Okay, before we move on to Prof. Ova and Prof. Ovi later, I would like to give opportunity for audience who have posted some questions, Judy. So there's the one question, several questions, but I think we can answer two of them first, and then we can move on and discuss the subsequent questions later after all presentations. The first questions, this is from Dr. Hikmawati Norohmanti. Thank you very much for your questions, Dr. Hikmah. And the question is in terms of psychological aspect, how would we deal with that? That's the first question. I think it's very good. And then second questions is management that we could recommend to all teachers who experience such a great shift or change. What kind of management or I think coping strategies or from the leadership point of view? I think you can respond to those two questions first before we move on to the next one.
Okay. Well, I would say from the psychological aspects, the Mind Tools website that I mentioned is really good. It's got some good things there about resilience, about grit. I think Angela Duckworth's work on grit is really interesting about how we can get through. In terms of self-management and how people could deal with that, I think it's quite difficult to actually give people sort of models and things. But I think as leaders, what we need to do is have conversations and be supportive. And I think that's the thing. And I think if we've got some awareness of the losses people might be feeling and how people, asking people how they feel, what can you do as a leader to support them better? Some people miss contact. Personality. I'm what they call a sociable introvert. Okay, so I love working at home. I love being on my own, but I'm very sociable as well. So I'm a perfect personality type for this, right? But one of my colleagues, Paul, is completely different. He's an extrovert. He's the one that runs around the building chatting and blah, blah, blah. And he's really missing that. So his adaptation is going to be different. So if you can know what sort of personalities people have got, again, you can help that. There are some really good well-being sites as well. And we've been collecting some resources, and I'll send them to Ardi afterwards from around the world. And you can have a look at those well-being things, because I think they're really useful.
Okay. Thank you very much, Judy. I think it's a challenge for everyone in adapting to such great changes, and it's global changes, a lot of uncertainties, a lot of unanswered questions. So I guess we're going to start to really listen from the first resource person dealing with everyday's hard decision making at the faculty level. First, we're going to hear from Professor Ova Emilia. Prof. Ova, thank you very much for joining us today. And we're going to share the presentation from our side. And please, co-host, can you spotlight Prof. Ova, please? Thank you very much, Prof. Ova, for joining us. It's a pleasure having you. And I will start sharing my screen.
Okay.
Containing
Thank you very much, Bu Titin. Hello, Judy. Nice to meet you and enjoying your presentations. well, in this occasion, thank you, Bu Titin, that I would like to just perhaps share, yeah, a very, how many, perhaps 6 or 7 weeks, yeah, the past 6 or 7 weeks we have with this situation. So my slides is about teaching, learning, and during the COVID-19. Can I have the next slide, please? So when we are looking of changing, Judy mentioned that there are lots of phases of changing. But when I think 2 years ago, we are really shocked with the 4.0 revolution that urged us to move more like IT, artificial intelligence, or Internet of Things, something like that. And many people still thinking about it. And many people also, like you mentioned, resist about it. But with this situation, the past 7 weeks, yeah, that we face the same like forces that we cannot like avoid it. We cannot avoid it. So we have to face the situation. So we face one challenges, the COVID, and a lot of restriction that make us cannot use the usual ways of teaching and learning. But we also have the like we also have like a duty, a process, activities that need to be fulfilled, and that is our responsibilities for students and also to the people. So this is keep us as a challenge. The other things we start thinking about, this is an opportunities that we start together, not only us as the manager of the faculty, but together with everyone, also the students and also the all teachers. So this opportunity is like we want to enhance the independence in learnings, as it is stated by our ministry, that we want to move to more independence in learning. Yeah, and we want to move to have more information technology in many things, particularly here in educations. So many ideas is already being explored, and the opportunity for the past 7 weeks is very extraordinary, that we try to realize it. Only in I would say it won't happen if the situation is not like this. So this is the good things. Everybody's shocked, but also we have to do something. We cannot stop here. So the ideas is very flourishing at that time, and then starting with all the teaching and learning and activities, and try to explore and being creative in many things. So the ideas, and also we try to identify the needs of all the stakeholders in our faculty, like the needs for the system itself, it's changing, and also the needs for training for the teachers or for the students as well, and also the needs for continuous improvement, because now this is the 7th or 8th week, so means that we are improving than when it was in the 1st week. So I would like to share about what we have done in the bachelor degree, any activities that is included the academic, next slide please, academic phase, and also the profession phase. So for the academic phase, we formulate a guidance for the lecturers, so for how to adapt their lectures, and we also support them with a team that can help them how to adapt their usual lectures to the online one, whether it is synchronized or asynchronized. And also the tutorials and also the practical laboratory and skills lab that's still possible to be in this online ways. And the other things is we at this point also involve the students in the community education, which usually we ask the students to go to the partnered families and communities. But with this situation, we use the WhatsApp groups. And this is very enjoyable because I also monitor and participate in 2 groups at that time. So there are many questions and the education is very close and very, I think, very effective. And it won't happen in the usual situation. The other thing, we also make a creativity in the project, or we call it a small cases, yeah, at the end of the academic phase. Like we use more secondary data, that we have surveillance data, and we encourage the students to use this secondary data for their final project, and also systematic review, or with and also with using the online exam. And this is also so any schedule that is regarding with the project is all can be manageable. And for the profession level, there are also some adaptations of methods, and also the guidance is formalized by the team, and the adaptations is on the bedside teaching, tutorial, clinical tutorial, or case reflections. And also the examinations is also being minimized, yeah, minimized, because like the patient is also reduced a lot. And in the profession level, we also have like a routine monitoring online, and this has not happened before. So now we always coordinate and do many administrative things using the online, and this is very good, very effective. You need I think a little time, yeah, than the face-to-face one. And also we I think many medical schools have the oath online using the live streaming. So for the clerkship oath and doctor oath, which I think never happened before. So the situation make us, this is possible, and it's good, and the student is also enjoying this. The other is for the profession, because the situation and the patient is not permitted. So we also plan the clinical deficiency placement, which will be planned after the COVID-19. So perhaps July or August, if that is the most optimistic plan. But we still will look at this schedule. And also for the profession, students also involved in the field work, which is related with COVID. So this is in voluntarily basis, but if they voluntarily to have the field work for the COVID, then they give like they got an extra like acknowledgement or certifications for something like that from the governor and the rector. Next slide, please. So next slide, please. And I think this is just to show you how we manage the health literacy that involving the students for the community, yeah, which is using the WhatsApp group, and also involving the students to talk to the community. Next, please. For the postgraduate program and residency training, as there are lots of like, well, we try to adapt some of the schedule. Like, for example, because this is in hospital setting, that we have to follow the rule that safety is the most important things. Safety for the students, and also safety for the people who come to the hospital. And secondly, the health service should still go, still run as usual. So many adaptations is done in the residency training. Like, for example, every 2 weeks they change the group. So this is also to practicing the self-isolations, and so to minimize the cross contaminations among themselves. And the number of the residents also being restricted. So how many that can go to the hospital, and then the activities and is also being structured very carefully. So how many that come to this polyclinic or in the ward or in the emergency unit. So it is being very carefully planned by the coordinator. And we use a lot of the online for the conference, and also for case presentations. And I think for the residency is more flexible, not only during the working time, but also up to in the afternoon or during night, when there is some special cases occurred. So the session is also on. And beside that, we also, next please, next slide. And for the residence training in the hospital, we try also to have to give a lot of support. So for the in the faculty, we are not only thinking about the program, but also about the safety of the residents. So we provide the health protection kit, and also the communication support, because they use lots of internet. Then they have to buy the package, and which is perhaps some people will have difficulty for that, and also providing some logistic package. So from this situation, next please, there are many activities, other activities also not directly related with the educations, but we have like we make a task force that related with this COVID-19. So the faculty not only have or organize the task force in the faculty level, but also in the university level, and bring it to the provincial level. So we have lots of contribution for these activities. The task force, next please. Like many things is done, like for the routine administrations, service for the students, or for the scholarship, and all are in online system. And also for the support for the students, as I mentioned before, for communication package, and also for the living, food for living. So some students still need it. Next, please. And next slide, please. And also for the support for the psychological services, which we found that the depression becomes very important here to be supported. So we have like in the university level a team that carry on the psychological service for all students, and also for teachers, and also for the other non-academic staff. Next, please. I think, many students' activities still are going on. Like, for example, the seminar, many seminars, we conduct the webinar, and every day is always webinar in different topics. And I think this is also make people more and more in participating in this seminar, and make easier to participate in many different seminar, and this is good for them. So I think this is my next, please. My last slide that is taken from your slide from Carhart and Trahan. So I learned your slide. Have we changed something? Yes, we changed something. We have already, the situation make us changing, to change the how people to work, yeah, how we schedule ourselves, yeah. We are not coming to the campus every day, but we have like who is the on duty and who can work from home, and also replan resources. And this is very, very important. And this is not only including us only in the managerial level, but everyone have to replan the resources. And the other thing is there are lots of cultural changes in communications, and perhaps also people who don't know about how to do the video conference now is very expert in that, and that's good, yeah. And also there are many, I think, feeling about the solidarity, yeah, solidarity, that we are in the same situation, so we have to like taking care of others, and we can carry on this situation together. And the thing that need to be, I think, overcome by all of us is the feeling of sometimes that we are, I don't know, perhaps depression. That is a sign of depression, yeah. Boring, or I don't like this, yeah. But I think this is only like your I think graph about the process, yeah. The process, there is some process that the feeling is like that, but hopefully we can overcome with that, and we can come to the new situation, new way of work, new way of teaching and learning, I think. And it would be more, I think, effective than the previous one, I hope. Thank you very much, Ibu Titin.
Thank you very much, Prof. Ova. Judy, in case you're wondering, Titin is my nickname. You usually call me by RD, so in case you're wondering, you'll be known as Titin.
Sorry.
It's okay, Prof. Ova. I usually introduce myself as RD to our international friends. Okay, thank you very much, Prof. Ova. I think your presentation is very encouraging, despite a lot of hard decision making. The Faculty of Medicine, Gadjah Mada University, turns out to get a lot of things into actions and adapting a lot of aspects, including the well-being. So I think, Judy, I hope you agree with me that we shall move on to the next presentations from Prof. Dwiana Ocviyanti. Co-host, would you please spotlight Prof. Ovi? Alhamdulillah, Prof. Ovi, thank you very much for joining us. Apologize for all the technical glitch that's been happening. We also learned that there are things that we cannot answer instantly. So thank you for being persistent in joining the Zoom meeting today. Thank you very much, Prof. Ovi. Prof. Ovi, would you like to share from your end, or would you like?
I think it's from me. It's better.
Okay.
So,
time is yours, Prof. Thank you very much. So Prof. Dwiana Ocviyanti is the Vice Dean Academic at the Faculty of Medicine, Universitas Indonesia. Prof. Ovi, Prof. Judy is also with us today. She just shared about the principles in leadership and change management. Time is yours, Prof. Ovi.
Thank you so much, Dr. Ardi, and then thank you for all the speakers for attending this meeting. We are very happy that we can be together and changing our experience.
Belajarlah.
Okay, so the first one is for my presentation is about the leadership and change management in health profession during the COVID-19 pandemic. On behalf of my dean, because my dean now still in rest, So we will explain that our Faculty of Medicine of Universitas Indonesia students consists of several levels of students. So that's how we think, what should we think about coping with this problem, with the COVID pandemic problem. We have the medical doctor program, the bachelor steps and the clinical years also. We have the specialist program, we have the subspecialist program, we have the master program and the PhD program. I think this is less than what Prof. Ova has, because Prof. Ova has a lot of program, but we only consist of the medical program. And the distribution, this is something like that, with total we have more than 4,000 students. So our adaptation to the curriculum, we should think about everything becomes so sensitive, but we should do everything so flexible. So that's what our aim. In this sensitive time, we should be very flexible, and we are supported with our rector very early, giving us the guide how to manage all the problem in the medical education and all the education during this time. And our rector give the very, very wide flexibility to all faculty to make our standard, to make the change of our standard module and everything as far as it is for the students, and to take care all the students also safety. So the flexibility come from the rector, and as a dean, our dean make a regulation for all kind of study under our faculty. The delegation of heads of academics program is to modify the modules. So our ministry also very, very clear, saying that in the modification, it is also yes, if the modification is something like giving the students chance to do something during the COVID time. So the changing is not only inside the module, but also make it more wide. If they have some experience of some doing some help, it could be also inclusive in the module. So they have a chance to still doing helping, but still having a remark for their module. For medical doctor, specialist and subspecialist program, our concern is about the research, because most of our program leader said that the research, most of the research cannot be done, because in the professional activities, most of the research is dealing with patients. And then the second thing that very, very deep in discussion about how to reach the clinical competency, because they are professionals. That's why we also make some special module for health services during COVID. And then the other thing is about the entrance exam, how we do the entrance exam and how do we do the evaluation exam. So we make it into a regulation that we give a chance, we give a very wide flexibility to the head of the program to make it, but they should discuss it with us so we can guide them and make a backup for them to say it and to back up it to the student. For master and doctoral program, our most problem is about the thesis. We cannot change it because we know that the outcome of the master degree and the doctoral degree is the research itself. So that's why we should make it very clear that if they have a problem doing the research, then what we can support them is to make a time for the research become longer, so we don't have strict on the time that they have, but we can ask for more time for their research, and we will ask it to the rector. So they will say to us what should they do if they have trouble or problem in their research. So the new concept for us, the most important thing, how to change the face-to-face education to the technology, we set it to the digital technology. like admission of new student. Before it is written test, interview face-to-face, and then during this time, we make a computer-based online and interview also via video conference. For professional education, the lecture also changed from face-to-face to the lecture via video conference. And also the skill training. Not every skill training can begin straight to the patient at the hospital, but we mostly make a skill training better before by using educational video conference. Also patient assessment and evaluation. This is very important for the specialists and subspecialists, and we make it, we change the program, which is very, very safe for the student, and also still they take care of the patients. What about studies evaluation? We have before written tests, OSCE, and case-based discussion. But nowadays, we mostly do the computer-based online examination. The clinical examination also could be done via video conference. The student make their video helped by their friend and the others, and then they give the video like for mini CX and something else. They give it to the examinator, and then the examinator give a feedback by online. And also the case report or journal discussion, it could be done by online. So this is the new things. This is what the example of digital application in medical education doing in our faculty. There are some digital imaging mostly. We don't really use the robots nowadays, but the digital imaging, we did it, and also doing most research on the secondary data from our data in the hospital, and then the communication technology we did by virtual education. This is mostly one example. Also, the high technology medical record, personalized medicine, and then artificial intelligence in medicine that being done. We did a lot of video conference also with our doctors all over the Papua. This is one of the sample. And then we did the webinars, a lot of webinar series. Most of the lecture with medical student conducted via video conference. And we point some important things that the appearance of the students is more than if it is in usual lecture, because we know really the exact number of the student attending our meeting, because we can see their face, and then we can make a conversation. So we can straight asking a name, and then we can see the face very clear because it is done by video conference. So that is the best of the doing the lecture by video conference. And then we make some lecture video type some lecture and giving it also to the resident. Much more creative creation from our lecturer. They have a lot of time making in their home, and then share it with the student, and the student can open it. Especially the specialists, they can open it during their time working in the hospital. And also we still have our morning report, night shift morning report, doing also by the video conference. How about the skill, transferring the skill? We have a live online demonstration. We don't have to have so many doctors come in, so many students come into the operating theater. We can do it a live online demonstration by doing it digitally. And then online exam, of course. And then online exam also use some kind of tools. This is the sample of our student examined by the lecturer, and using their own things like this, their own. This is the examination for eye examination, and then they're using their puppets to present their skill in doing the examination. And this is for the MD graduates. We have also our Hippocratic Oath by Zoom via online, what we call it as Angkat Sumpah, and we did it also by online. I think many of the faculty do the same things. How about the interview for the new student? We also do the interview for 50 talent scouting by Zoom, and then we can do the examination like we did it before, but it is only by Zoom. This is the most important thing for clinical practice. Mostly is for our resident. We have three things, very careful about three things, about the safety, the standard PPA, about giving them the routine examination by swab or rapid test, and by supporting them with health insurance, because there is of course they feel afraid because this is a COVID time, the pandemic. So these three things really supported by us. Of course, we cannot ask for the hospital to pay for this because the hospital has some resistance, of course they don't have money, and also the faculty. So we ask for our alumni to do that, and then some of the donation from others. So we really do asking for donation for our students, so they have the PPA, very, very good PPA to prevent them of having the problem. And then also donation for the routine examination, even it is not always PCR, some of them is rapid test. We have some donation to give it free to our student. And also the insurance, we have a collaboration with the BPJS Tenaga Kerja that can support at least for 3 months for our student to have the supporting if they have something happen during their work. The other thing, the last, but it is also very important, we already prepare for a really emergency situation. Maybe if the patient becomes so high, we should ask our students to work, and also the residents from other program. Of course, nowadays, still working mostly is the resident from the internal medicine, the anesthesiology, the pulmonology, the OB/GYN, and the four big pediatric and something else. But all other residents, we will try to prepare them. If there is something happen, they also can help in the hospital, and we give them the special things. We have a training package made by Dr. Ardi and friends. Guideline, this is for our students. And we already asked Dr. Ardi and friends to prepare another guideline book, training for the resident from other specialties, like we have aviation resident, acupuncture resident. They also can help doing something during the COVID time, but we should give them some training. So this is what we did during this COVID time. Maybe we can share our experience with others, and we can hear others' experience how to make our students still online, on their way, having their things that they want during this COVID period, because we cannot only stay at home without doing nothing, but we still should give them everything to make their competency at the best during this COVID time, but still to prevent them of having problem during these COVID times. That's what I'll present, and thank you for your attention.
Thank you very much, Prof. Ovi, for a very insightful presentation. Before we move on to the next presentations, I would like to post questions from Dr. Adrianta, who would like to know the experience from Faculty of Medicine Universitas Indonesia, as well as Gadjah Mada in regards to the, let me check, Dr. Adrianta, wait, okay, so in regards to the how the two institutions arrange the assignment of medical students in the clinical rotations in the teaching hospital, or do they have to stay at home? And whenever the medical student would like to volunteer, what is the policy actually? Probably Prof. Ovi first, and then we can move on to Prof. Ova. Thank you.
Okay, thank you, Dr. Adi. So we have a program for medical students who want to have helping, like now to Wisma Atlet. But the first thing we said to them that it should be it should not be making problem to their education. We don't really make them staying home. Every medical student, now we ask them to have a what is this, education from home by a webinar and something else. None of them is going to the hospital at this time, but they still have something to do, a lot of things to do. We modify the module, make it shorter, and then spend the time for the clinical rotation. Really, they should go to the hospital later. We hope that we will become better later, but we still wait. That's the first one. We make the module shorten, and then the rest of the clinical experience, we plan to put it together at the last time of the semester. But if they want to do something to help, yes, they should ask to the faculty whether they're allowed or not, because it depends on this student have a problem in education or not. If they are clear, then they can doing that. We have 40 students now helping the Wisma Atlet or helping the BNPB for doing something during the COVID time, but mostly they do the education from their home. They're not going to the hospital, not yet. So that is what we did. Now they can do some helping the program, but still under the supervision of our faculty. Yes,
thank you very much, Prof. Ovi. Prof. Ova, would you like to respond further about the decision making?
Yeah, I think the regulations is generally similar. Like for the rotations, we don't do the active or actual rotation in the hospital, but they can join using, I think, many activities like clinical tutorials or case presentations, or so more academic and for building up their clinical reasoning skills. But for like exposuring or with the patients is at this time is I think restricted, yeah. But some of our medical students, because fieldwork or KKN is one of the posting for the clinical rotations, so they are also offered to join for this fieldwork by helping for the COVID activities. Like for example, they do the call center, or they also assist the tracing team with which is organized in the university level. And I think not only for the medical students, the university is also recruiting for the voluntarily work for students, and most of them are merely deal with for improving the health literacy of the people. So we try to involve students by partnering them with what you call it, the youth movement, the Karang Taruna people. So in the village level, and this is also to give like a response to the provincial level, that they need us, the university, to also involve in this movement. And this is also inviting other students from other university of doing the same things. Thank you, Bu Ardi.
Thank you very much, Prof. Ova. And there are some questions before we move on to the next presentation about the understanding of students' challenges, simply as probably the internet connections, which is very important in distance learning. So is there any policy from Gadjah Mada or from Universitas Indonesia in regards to supporting students who probably has such challenges in their network or internet connection? Prof. Ovi, I think you have the answer already.
Yes, we are not lucky because we don't have money from the faculty and also from the university to give to the student. But we are lucky enough that we have a parents group that can support this. So we have now, I think, more than 70 medical students now being supported by the parents group. if they don't have money or enough money to support the online the online education, we give them at least 250 rupiah, 250,000 rupiah a month, but it was given by the organization of the parents of the medical students. So that's what we.
Yeah. Okay, I think the support is there and it is organized by the faculty, but I think the amount is not as big as in Jakarta. So, but this is very selected. Yeah, very selected. I mean, the rich students, I think, do not need this, but mostly are the students that they can propose, they can ask for the support, and we give the support not only for the undergraduate but also for the postgraduate students. Yeah.
Okay. Thank you very much, Prof. Ova and Prof. Ovi. And Judy, thank you very much for responding to a lot of questions and comments in the chat room. You've been very helpful and very fast typing, I know. So as the last presentation, I would like to share with you all of the participants about this is really the reflections from the medical teacher or the educator perspective. So I will just share the screen. Wait.
May I add something, Dr. Ardi?
Yeah,
there is a question or a statement from Dr. Melania about the lengthening of educational period. But we tried with our rector in the university, in our university, Universitas Indonesia, we try so much not making the education time become lengthened. So we try not to make it something like that, but we cannot stop lengthening the education for the magister and the doctoral program, but we give them the chance of giving them some tuition free, not whole, but by doing some kind of what we call it as a time for leave for them. So that's how we support them, so they don't pay so much, because the outcome of the magister and doctoral program is the research. So we cannot make it stop during this pandemic, but we should wait until the pandemic time is over. Thank you.
Thank you, Prof. Judy, would you like to have a short comment on this, on the cost, whenever one of the impact is lengthening of the study?
Yes, I think I answered a little bit in the chat, but I think similar things that we're doing in the UK, certainly my PhD students, they're completely stuck. My daughter's the same. She's doing her PhD in schools. She's a linguist, and her research has just stopped dead. So the universities are, they've stopped charging students for the final semester. Mm-hmm. And they're not going to charge students for the additional time that they might take to complete their studies. Mm-hmm. So, but until we know when we restart, it's so uncertain. So they've just said, look, for now, we'll graduate everybody we can, but actually those of you who are a bit in limbo, we'll just do extensions or deferrals, and I think we've just got to play it by ear because we don't know when we'll be back.
Mm-hmm. Okay, there are also a lot of questions on the changing management, and whenever we have resistance, not only from the teachers, but also from the students who tend to resist in participating in the distance learning. I think I would like to offer this. I will give my presentation in short, and then we will discuss and come back to that very issue on the change management and leadership overall afterwards. Okay, so. Does it come out okay? Hopefully it is. Okay, so the basic of the foundations of these reflections is based on what has been happening in the past 7-8 weeks in Indonesia, and I think probably longer in other parts of the world. And in terms of a lot of changes in educations, I would like to share just short reflections on the importance of communications and the adaptations during the uncertain times. I would also intertwine some reflections on the cultural aspects later on. So I hope that all of you agree with this, that leadership is not about the position or a title, but it's more about the action and example or role modeling. So I believe that everyone, regardless of the positions in the Faculty of Medicine, everyone is a leader. Hence, each one of us needs to reflect what kind of role that has been expected from us, whether we are the clinical teacher, whether we medical teacher, whether we are medical educationalist, whether we the course organizer, etc. So as mentioned by the first three speakers, I think we all agree that this COVID-19 pandemic leads to great changes in meeting family and people. I think I miss my parents so much, and I think everyone miss their parents so much, and then miss our colleagues, miss the chit chat in the morning during coffee time, for example. And then in working and learning, we've been working from home, and there are a lot of changes in the pattern of working as well. And there's also the danger of working from home, that the border or the line between work time and the domestic time or home time becomes seamless. So in a way, we need to there's the change in that, in using technology, in keeping ourselves safe in our daily life, really. So every aspects in our life. And as Judy also shared with us, there's this, we need to also reflect at what stage are we now? Are we still in shock? Probably we passed that. Are we still in denial? Probably we passed that. Probably some of us still in the frustration stage, or hopefully not fall into the depression stage. Or probably some of us has been trying our best to do something, to do some constructive changes in our program and decision and integrations. We can see the examples from the Faculty of Medicine, Universitas Indonesia, as well as from Faculty of Medicine, Universitas Gadjah Mada, that there has been some experiments and this great decisions made, and also the integrations into the daily life of the medical teachers and medical students in the two institutions. So I guess we passed, probably in terms of the leadership, our leaders have been moving to, we need to decide something, we need to do something, and it's good. So I would like to ask each one of us to really reflect on who we are and what we are. We are an individual, we are a mother, we are a father, we are medical or health professions teachers, we are a health professional, we are a medical doctor, we are probably a student, a daughter or son, and you can fill the blank. So I guess in terms of reflecting on what's happening, to my personal reflections, it's also important to see how we see ourselves. So how we identify ourselves, so that later on we can make decisions and try to see what's in our control and what's in our influence and what is beyond that. So this is the first reflections. Communication, communication, and communications. I think Prof. Ovi, I think, is the witness of intensive communication. I think Prof. Ova also, sorry. So what should be communicated? If we as a teacher, we have initiatives of doing something. For example, we can use video conferencing platform other than Zoom, for example. We can have Microsoft Teams, we can have Google Meet, for example. As a teacher, we can actually initiate that and discuss that with our team without always probably waiting for others to help us or to ask us what to do. And our vision is whether we communicate what to solve the problem now, or we also see how we set the new foundations for the future. And again, what is the priority? Communicate with whom? Probably among our colleagues in our departments, or probably across departments. As Prof. Ova and Prof. Ovi shared with us just now, there are a lot of communication, a lot of discussions, a lot of decision-making processes that need to be done. Communicate with, as the medical teacher and medical education unit team members, we have been having a lot of intensive communications with the deanery, the leaders, because we need to also, of course, advocate certain things, but in terms of a lot of strategic decisions, it always need to come from the top leadership in the faculty. And please do not, I think based on my personal reflections, we cannot leave the students. We always need to involve and engage with the students from the very early stage of any of the changes, any of the probably in changes on teaching learning processes or certain amendments or changes in a schedule, for example. When? How early? When do we actually need to wait? Because thinking of the priority of what to decide, sometimes you also need to wait that there are a lot of questions, there are a lot of decisions that cannot be made at certain time. How? Whether we're going to communicate that personally to probably, for example, I myself having a personal communication with the Vice Dean, Prof. Ovi, in this regard, whether we have the discussions in the group of decision makers, and how is it, through emails, through video conferencing, or what? What's the media? So I think it's important. And in terms of what to communicate, I would like to reflect on what Judy has shared with us. I think it's very helpful to see what we can control, what we can influence, and what we cannot either control nor influence. So I guess it's, if we think about, for example, at the moment, the national policy about quarantine or the lockdown, for example, it's beyond our control, it's beyond our influence. So I think we need to really focus on what we can control on, or with what we can influence based on the roles that we try to link ourselves into. So we need to consider our competence, the team that we have, the supporters, the opportunities, as well as challenges. So it's about really exploring the control and the influence here. And again, this is also from Judy. Most of you say that we've been facing complex issues, complex decision-making process. And I would like to probably try to make some examples based on my own reflection. Simple task probably is about choosing platforms of video conferencing, whether we're going to use Zoom, whether we're going to use Microsoft Teams or Google Meet, for example. For example, my session tomorrow with the resident or with the students. That's supposed to be a clear-cut decision. Which platform are we familiar with? That must come first. Complicated. The example probably is, do we need to assess the students now? Do we have last week we discussed a lot about assessment, and we agreed that it's important to see whether we have already certain data points from our students that and now it's important to stay safe and to make sure that everyone is safe, rather than trying to push the assessment, the summative assessment, without considering that priorities. Complex. I would like to suggest, probably this is the question: shall we assign our students in clinical rotation during this pandemic? If we have to do that, what kind of considerations that needs to be done? The competence of the students, the supervision, for example, how about the safety, and etc. And this one is the chaotic one, I guess, I think, and I would like to, until when we have to conduct the full distance learning in this pandemic? We don't know, we haven't, there are no studies, no research that can determine for sure until when this is happening. So probably these are the chaotic things that it will be very hard to decide. And this is my reflections. Probably you have different reflections, because I believe that this is very contextual, depends on your settings. And there are a lot of questions about this. What about if we have a lot of teachers or students with high resistance? We can discuss that later. And if we would like to communicate certain ideas and certain initiatives, whether we would like to start with the ones with the high acceptance, do we know the familiarity of the technology use, for example, and etc. and etc. And I like this graph because we need to really understand our colleagues and so that we can identify what kind of support that we need to provide. Even from one colleague to another, doesn't have to be a certain unit like medical education that needs to support the academics or the staff. But in the reality, there are some people, our colleagues, or probably our students, who are in the late majority and laggards, which naturally very hard to change. So I think Judy later on can also discuss about this, how we will deal with this, considering a lot of priorities and a lot of decision making processes. So reflection number 2 is culture. So the second C after communication. So Judy has mentioned about these dimensions, and I would like to only highlight on individualism and collectivism, power distance, and uncertainty avoidance. Indonesia, based on Hofstede's framework here, Indonesia is the country with collectivism, high power distance, so a lot of hierarchy, and high uncertainty avoidance. So we tend to avoid uncertainties. We probably you start to see the dilemma or the paradox here. Currently, there are a lot of uncertainties when, in terms of the culture, we are considered as tending to avoid the uncertainties. So back to this graph, I think in terms of the simple, complicated, and complex and chaotic problems with regards to the certainty as well as the agreement, I think we also need to reflect how are we going to deal with this, how we're going to make decisions. Our two female leaders from two renowned universities have shared with us that yes, it needs to be done, it needs to be decided, but I think different universities, different settings would need a different approach, considering a lot of aspects, including the organizational culture as well as the teachers and then also the students' perspectives. So based on this channeling effect on transition model from bridges, I would like to probably try to highlight or suggest how we can link that with the culture. In terms of a lot of uncertainties, do we as the teacher or as the students, we have longer anxiety, longer phase of confusion probably, or probably a tendency to fall into depression, since in terms of the culture, we tend to be avoiding the uncertainties. So I don't aim to provide you with answers, but more into the more reflective questions. Secondly, in regards to the need of guidance, the challenge is that currently the leaderships, the top leadership cannot always make decisions because not everything in the current situation has clear-cut solution, have complexity, even a very chaotic situation. However, we can see that the transformative leadership, constructive leadership, and in this power distance culture, leaders' role is even more important, I believe. So that the communications of these aspects about the clinical students, we have to decide, and then whenever the students ask about until when we have to do this, until when we have to postpone our clinical rotations, that's the thing that actually, based on our data now, we cannot answer that. Lastly is about collectivism. We are known as Indonesia is known as the country with high collectivism. So I think we can see this as opportunities on co-creation and collaboration. I can share that among our colleagues, medical teachers in Faculty of Medicine, Universitas Indonesia, for example, we can just ask questions about how can I use the Microsoft Teams, and then another colleague will just you can suddenly come up with a certain simple guidance that everyone can follow. So a lot of opportunities on co-creation and of course collaborations. And I think we can, as Prof. Alpha mentions, about solidarity and about collaboration, of course. Last is about change. So reflections, the third C is change. Judy, thank you very much for developing this paper with Paul. I think it's a very reflective paper on 12 tips for applying changes. And based on my self-reflections, I don't think that personally because this is personal reflection, I don't think that personally I've implemented all steps, but in terms of communication, culture, and also the change, I think I would like to highlight in squares the steps that I think we've been doing individually as I've been doing individually as medical teacher. identify the purpose and try to identify the quick visible wins. Prof. Ovi has shared about the modul tanggap pandemi COVID-19, which we have initiated, and I think that's some quick visible win, highlighting the communications not only with our colleagues here in Faculty of Medicine, University of Indonesia, but also reaching out to wider community. Analyze the internal environment and culture. Consider the external environment, cultural context, and political influences. And choose the right combination of approaches to change. And then acknowledge the psychological impact of change, not only to others, to other colleagues, but also to ourselves. I think we need to be reflective whether we think we're depressed, whether we think we're confused, etc. I think it's important to be honest to ourselves first before we can move on to make changes or to make actions. And again, we cannot underestimate the complexity. So I would like to close the presentations with these take-home points. You don't have to agree to all of these points, but this is from my own reflections that I think we need to accept that we cannot always understand what is happening. It is okay not to be okay. And managing our visions and further actions within things we can control and influence probably is important, so that we can limit to the things that we can control rather than discussing a lot of things that we cannot act upon. And the rest is our chance to actually learn the things that beyond our control is actually the things that the opportunity for us becomes the venue of us to learn, to collaborate, and to change. And I guess probably we need to start to ask, what have we done so far? And what have we learned? With that, I would like to thank you for your kind attention. Yeah. So I would like to invite all of the speakers. So I think I would like to move on to the questions about how we deal with the resistance. Judy, would you like to respond to that?
With resistance?
Yes.
Okay. From faculty or from students or both?
Yes.
Both. Well, I think the learners, I in the chat, I sort of set something out that I was thinking. I think for learners, we've got to do a carrot and a stick. So the carrot is making things useful, relevant, fun, interesting. Okay. The stick is they have to do them to pass some sort of assessment. So it has to mean something. Okay. Mm-hmm. So I think, you know, for me, for students, engaging them. And the other thing is, you know, don't waste precious webinar synchronous time when people can do things in their own time. So let the learners learn the fact-based stuff, I think, you know, okay, asynchronously, and then things in real time, make them really meaningful. So that's where you might have cases or your virtual patients or whatever, or video, so that they're really learning something and it's valuable. And time those, you know, don't overwhelm the students with loads and loads of webinars and videos and meetings. You don't need to. I think for faculty, again, I think probably less stick, more carrot, because we're more grown up, hopefully. So I think, you know, that's supporting people. It's asking people where they're stuck. Are they lacking in confidence? Do they have the skills and the competence to do these new things? I mean, I said in the chat, I'd never used Zoom until this happened. You know, I'm learning all the time how to use the different bits. You know, I'm not perfect on Zoom, as you saw. But I think, you know, it's that, what competencies, how do you need to work, what support, have you got the technology, have you got the bandwidth that you need? Yeah, you know, so I think that's how I would approach it with the resistance.
So it's about understanding the underlying reasons why people resist.
Yeah, going back to basics. Yeah.
And it can take some time, actually, I mean, if you have to make fast decisions.
Yeah, well, okay. That psychological transition will probably, probably most of us are still in making the transition because we think we're going to come out of it soon and everything is going to go back to normal. That's psychological protection. That's what we do for ourselves. We go back to what's safe and what's normal. It won't be like that, but psychologically we can't live with that uncertainty.
Okay, thank you very much.
Because humans can't. We need something. We need to make a plan. So, and that's what people were saying in the chat. You know, this is really hard to do that. Really hard. You know, I'm planning for next year to come to Indonesia. Well, that might not happen. It didn't happen this year. You know, so you know.
Yeah. Okay. So we are approaching 4 p.m. at the moment, and we still have a lot of questions. Prof. Ovi and Prof. Ova, before we move on to some closing statement from each speaker, and I would like to share a last poll for everyone. So this is the question for everyone. And to those of you who have given us questions, and I think there are a lot of good questions. We're going to group the questions, and probably if we will send them to the resource person, and later on we will give the feedback from the resource person to you. Okay. This is interesting. But it's good that all of us, we've been we are now becoming more realistic that we cannot expect certainties. And that's good.
Yes. Yeah.
Okay. Yes. So, and Paul,
can I share a little experience?
Yeah, please, Prof.
To make a plan for this.
Yeah.
Of course, we should take care of our epidemiologist expectation or future plan, but something like that. So for us, we already think that this pandemic situation will not finish at least for 6 months from now. So before we take a look in Indonesia for 2 weeks, and then the next 4 weeks after this, we already make a plan at least for 1 month. But then we know that, okay, we can see now and asking for our epidemiologist friends, what will happen? Then we know that, okay, it might be the peak in Indonesia will be in June. And then we hope everything will be okay until the end of October. So we already make a plan for at least 6 months. We know that before 6 months, because if we really don't have any time consideration, it will be very hard for us. So we should try, and we should be very sure that, okay, at least. But of course, we have the next plan. Maybe if not, if they still become worsen, so we know what will happen. But we now have a positive mind in ourselves that, okay, it might be until the end of October. We still have November and December for looking what we call it, making a module for increasing the skill ability for our students, because it is really very important for them to meet the patient, but it's not before that time. Except if it is become better earlier. I don't know. How about in England? Do you have something, Judy? You have something? Yes, the plan. At least you should have a plan. How about you?
Yes. Yeah, we've got a plan, and it's very similar to yours. They're talking at the moment for that universities might actually not have a September entry, but they might have a January entry. That's a big, huge thing. I don't think it'll happen, but you know, it might have to, because if we look at the flu pandemic, we've seen 3 peaks. You know, we don't even know if we think we're just over our first peak, but nothing's nothing's happened with releasing lockdown or anything. We won't have international students coming to the UK next year, I don't think.
Okay.
You know,
very much.
Yes. And for medical students, we also think about, yes, if it is not ended at the end of this year, or it is ended at the end of the year, we know that our medical students still have a chance, what we call it in our curriculum, we call it as a pre-internship time. So we know that, okay, if it is not happened until the end of this year, then we will put the last year students making a modification for pre-internship or even with the internship time. So we will collaborate together with our profession, the Ministry of Health, to take care of them. And we will not release them without their ability in doing something clinical things, of course, because they will become a doctor. So still we have a next plan and then the other plan, something like that. I think Prof. Ova also have a ready. I think that everybody will be ready for the worsen plan if it is happen.
Given the time, I would like to ask each speaker to give some take-home points, probably starting from Prof. Ovi, Prof. Ova, and then Judy.
Okay, from me, I think the most important thing is thinking about it as early as possible. We should try as a management, as a leader, we should try to make not only saying that please be calm, but making all the strategy to make everybody have a plan, because making a plan is really very important. So don't stay without any plan. We can make a plan, the shorter one and then the lengthened one, but it should be a plan. It should be a regulation. It should be a backup for them. So that's what the leader should do in this case, in this situation, is to modify and to be flexible, but still inside the regulation. Thank you.
So regulation as the guidance, yeah, Prof.
Yes.
As the guidance. Thank you very much. I think that's a very critical note. Prof. Ova?
Yeah, thank you, Dr. Adi. So in the situation like today, that we face the same situation, whether we are ready or not, then we have to learn the new things, learn to look at the new thing. I totally agree with what Professor Ovi, my friend, said, that we have to have plans. I would my word is scenarios. We have to get different scenarios, whether it is short-term, middle term, or long-term scenarios. And the most important thing is no one is being harmed or for the situation, and we can overcome the situation with I think winning situation for everybody. Thank you, Dr. Adi.
Thank you very much, Prof. Ova. So we need to prioritize the safety as well, while still flexible in trying to see the different scenarios. Thank you. Judy?
I agree with the planning and the options. That's really important because we need to be really flexible. I think I would say things. Firstly, let's continue our fantastic collaborations and communications across the sectors, across countries, because actually we're all learning, we're all adapting, and we're all facing very similar challenges. It's not a time for competing. It's a time for, I'll say this, the more feminine type of leadership, which is about collaboration and transformation. And then the second thing is, is actually let's not go back to doing everything that we did before, because I don't think we need to. And I've said for a long time, why are we building huge lecture theatres and all this massive why are we doing this when we've got technology? Well, we've been thrust into a different way of working. So let's take the best out of it. And then when we do return, we've been innovative and we've been a bit transformational.
Yeah. Thank you very much, Judy. And
Thank you.
To add on the take-home points, I think personally we need to always see what we can control, so that we can put some actions upon it and think about whether we can actually expand the influence and really focus on that to make impact, I think, to our nearest environment, and hopefully can be larger than that. So with that, I would like to thank you, to thank all the resource persons who gave us a lot of insightful and school of thoughts on leadership and management. It's not about the position or certain positions, but each one of us needs to see contribute to the changes that needs to be done in such difficult situations for everyone. And it's not only about Indonesia, and we also have participants from Malaysia, in UK. I think it's global challenges. Thank you, Judy. Thank you, Prof. Ovi and Prof. Ova. And to all participants, to those of you, apologize for not being able to responding to all questions. You can still post the question. We will save again the chat here. And if you have further questions, you can post to our email. And for the recording as well as the presentations from all speakers will be available on the links that has been provided in the chat room. And next week, please do not forget to join us again in the webinar, the next series on the adaptations of the instructional design for online education. There will be Dr. Jeroen and from Maastricht University, as well as Dr. Astrid from Universitas Surabaya, who will be with us. And there will be interesting interactions, not only through polls like we tried today. I think you hope you like it. You like the polls, you can see the interaction. Next week we will have breakout rooms, discussions, and some works to do in the small group. So we hope that you can join us again. Thank you very much for your time, and for those of I would like to also say selamat menunaikan ibadah puasa Ramadan. Mohon maaf lahir batin, and all of us from Medical Education Center in Faculty of Medicine and Universitas Indonesia, we've been collaborating to conduct this webinar with the Perhimpunan Pengkaji Ilmu Pendidikan Kedokteran Indonesia, Indonesia Association's Medical Health Professions Education (IMHPE), Faculty of Medicine Universitas Indonesia, Faculty of Medicine Universitas Gadjah Mada, Faculty of Medicine Universitas Erlangga, and again from Swansea University. Thank you very much, Prof. Judy McKimm, for joining us. And we will still have a series of webinar until 14th of May 2020. So we plan to have 7 webinars around COVID-19. Thank you very much, everyone, and stay safe and stay well. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Kenapa?